Okay, everyone, we're here with our next interview. Mike Nelson is the president of Radar Find, and I'm excited to find out what Radar Find does. Mike, we're really glad that you're here with us. We've got a lot of folks out there on Twitter, and following this Ustream, we're going to record it so that we can use clips later on our blogs. So just to get our audience oriented, perhaps you can tell us a little bit about Radar Find and what it does, and if are you the founder as well? Or
I'm not.
You're not? Okay. No problem. Just tell us a little bit about it.
I will do that. So Radar Find is about a 6-year-old company, and we make what we call a sensor network. And our sensor network is deployed in hospitals, and it allows us to do two things. It allows us to find anything, people, staff, patients, assets, real time, and also allows us to discover a little bit more. What we call status. Is it warm? Is it cold? Is it moving? Is it not? Is it together with something else? Those sorts of things. Think of it as this isn't quite right, but think of it as an indoor GPS system.
That's really great. Is it warm? Is it cold? That's a good thing that we need for our patients. So you can find equipment. What do you? How does this work? You put stickers on things, or what is?
Well, we can find equipment, and what you find in the hospital environment is they have an enormous investment in mobile equipment. It's all on wheels, it all moves, and the truth is they rarely know where it is, other than it's in the hospital. And what we do to solve that problem is we put what we call tags on an asset or on a staff member or a patient, and those tags are small, and they're battery powered, and they broadcast, as I say, where I am and what I'm doing. And that allows for many, many things. But the thing that perhaps is most obvious is if you can find what you're looking for quickly, and you're a nurse, you save time. And that allows you to spend more time with patients, which is very important. If you're sort of economically inclined, if you can always find your assets when you need them, you may not need as many, so you spend less on them.
That's absolutely right. And you can find out where the nurse is hiding your EKG machine because she needs to keep it for herself.
That hoarding behavior is legendary. You know, if you spend your day chasing down infusion pumps and you know you need them, you tend to have one and you stick it in a closet and it's yours, right? Our system allows for that hoarding behavior to just simply go away. You don't need it. Right. In fact, we had one of our hospitals hold what they called Amnesty Day. Bring them back and we won't ask questions.
Oh, that's really cute. Now, I also noticed that Radar Find can be used to detect falls. Is that right?
Well, it's actually a thing that we will do in the future. As I mentioned, we sense more than just location. We can sense many, many things. One of the things we're working on is the sensing of, this is a little bit technical, but motion, attitude, and acceleration, and those three things together. And if we can do that, we believe we got the basis for predictive algorithms that would allow us to say, you know, I think you've got a patient at risk for a fall here. And that could be pretty exciting.
Because their velocity just increased as they're running down the hall?
Well, actually, it's more likely that you get a patient trying to get out of bed a little too early and wind up falling out of bed. And we think there's probably a motion and attitude signature that would alert someone that might be happening.
That's really interesting.
Sure.
I'm a rehab physician, so I live to prevent falls, basically. And then when people do fall, I get Humpty Dumpty back up again and and help them, walk and so on. So how would this work? Like, I'm just trying to understand, does the patient have the sensor on their gown, or where is it embedded? And
well, again, we're working on this. What enables this is there are many, many kinds of sensors. If you're, I see you're an Apple fan, so you may have an iPhone.
I do.
Your iPhone has a GPS in it, has a magnetometer in it, has an accelerometer in it. Those are all what we call sensors, and they're embedded in silicon, and they're actually small and relatively inexpensive. And all kinds of sensors, temperature, acceleration, motion, those sorts of things. If you combine those kinds of sensory technologies and you add some math and some logic to it, we think we can do all kinds of things. But with regard to your question, you would attach a tag with the appropriate sensors to a patient, perhaps on their gown, perhaps on their wrist, not sure yet. But it would sense what they were doing and at what speed and at what attitude. And those three things together, I think, will tell us a lot.
That's really interesting. So in addition to reducing hoarding behavior and finding patients before they fall, what are some other applications?
We also can sense things like temperature. So we put a temperature sensing tag in a refrigerator, and we can tell you when the refrigerator is out of its normal range. That allows you to avoid relatively significant financial loss. I was at a hospital about a week ago who said that they had vaccines stored for the H1N1 flu. The refrigerator failed, and they lost all the vaccine, which was both inconvenient and an economic loss. But what they went on to say is because they learned of that in the middle of the flu, they actually had to pay an extraordinary premium to replace the vaccine. So it was a pretty significant economic loss for them, one they could have avoided.
Absolutely. Well, is there some sort of dashboard involved where, someone can look at the input from all of the different sensors and manage that? I mean, what does that look like?
Well, we sell systems. We sell hardware that reads these tags I was describing. We sell the tags, and then we sell software that allows you to interpret what you're seeing. And we sell various modules that help you do certain things. For instance, our software will render a map view of the entire hospital. You can pull up the hospital by floor, rendered in CAD drawings, and that would allow you to see anything tagged in the room they were in, on the floor they were on, and the status they had. So, and then we have software that will sort of carve out certain things. If you just wanted to see refrigerators, for instance, and their temperatures, you could see that. If you just wanted to see infusion pumps that needed to be cleaned, you could see that. One of the things we do that's pretty unique in our industry is we have a tag we call a status tag, and that status tag allows us to understand not only where an asset is, but whether or not it's in use, whether or not it needs to be cleaned, or if it's ready. Because knowing where it is only the beginning of the battle. You have to know, can I use it when I get there? So the status tag is very important.
Excellent. Well, we have a question from Twitter, and Dr. Anonymous is going to read that question to us.
This is cool. How cool is this? we have a live question. The question is, will this system eventually automatically track inventory? How about automatic drug, opioid, and other sensitive drug tracking?
Well, we can track the location of anything you'd care to tag, and the sky's the limit. What we find is hospitals, as they begin to understand what these systems can do, get more and more clever about how they use them. So yes, this could be used to track inventory. In fact, we interface fairly frequently with asset inventory management systems as a result. With regard to your question about drugs, sure we could. We could track. So I think that we could track the status of anything stored and its movement or lack thereof, and that would allow you to control controlled substances fairly easily.